Inside the eye, we have a lens, and this lens is in charge of moving and focusing the images far and near from the eye. Well, this lens with age stops moving, and then after it stops moving, it stops focusing. That's why we need the reading eyeglasses. Starts to change color. Instead of being transparent, it changes to a yellowish and then much darker color, and so it reduces the amount of light that goes into the eye. That's when we call it a cataract. So this reduces your vision. Typically at night you might see some glare, you might have some halos or some starburst effect after when you start with cataracts. And the only way up to date that we know how to treat a cataract is to actually remove that opaque lens and replace it with an intraocular lens. One of the biggest advantages right now with the intraocular lenses is that we have become very precise in regards to the measurement of that lens, so that after the procedure your dependence on eyeglasses can be reduced. And now, as technology is being evolved in regards to how those lenses are made, now we can do multifocal lenses and implant those multifocal lenses, so that improves your vision not only for far but also for near, without having to wear some prescription eyeglasses after the procedure. So overall, cataract surgery has evolved tremendously. Now we are able to do cataract surgery with a laser. Here we've been using the LensX laser for several years now. One of the biggest advantages about the laser is that it's very precise. The procedure, the laser procedure takes around 40 seconds. The laser consists, the procedure with the laser does the fracturing of that lens. It turns it into little bits and pieces. It makes the capsulotomy. The capsulotomy is very important because it will center or help us center and place the new lens right in its place, right where we want it. And it helps us also to make the incision, so there's no more blades when we do cataract surgery when we're using the laser. And all that in about 40 seconds. It's amazing. So as a surgeon, what we do when we do laser-assisted cataract surgery is basically clean up after the laser and implant the lens. Basically, the risks of cataract surgery are the same as in any other type of surgery. If we have some trauma, if something goes into our eye or hits our eye, hurts our eye after the procedure, well, depending on how bad that trauma could be, it will definitely hurt the procedure. The other thing we need to be very wary about is an infection. So if something goes into the eye that infects the eye, then definitely your vision is not going to be as good as we expect it to be. So it's very important after the procedure to wear some protective sunglasses to protect your eyes from anything going into your eye or hurting your eye, as well as applying the eye drops that will prevent an infection during the first 48 hours. One of the biggest advantages about laser-assisted cataract surgery is that it's totally painless. The procedure lasts less than 40 seconds. We put in some eye drops that'll numb your eye. You do not need to be put to sleep. And routinely, that's all it takes for us to do the procedure, totally painless. Cataract surgery is a very delicate procedure because we're going into the eye and we're removing part of your eye. We're removing that lens that turns into a cataract. We're removing that cataract, and it's something that is very delicate. It is something that your surgeon should have lots of experience doing this type of procedure, and obviously very good results. We've been doing cataract surgery for more than 20 years now, and we've been up to date with all the newest technology in regards to getting our best results. Cataracts can be found at any age. In fact, there are some kids that are born with cataracts. So it's a good idea to always, for preschoolers, have them checked by an ophthalmologist, make sure that their eyes are healthy. During teenagers may develop cataract, so that will definitely reduce your vision, and in that sense it's very easy to diagnose by an ophthalmologist. But most of the patients after 55 years of age might start with a little bit of a cataract, and then as the vision decreases, then that's the best moment to remove the cataract. Recovery time after cataract surgery is extremely fast. In fact, here at the Vision Institute, we do not patch the eye after cataract surgery. You need to be applying some eye drops to prevent an infection, and you do need to take care of that eye of not hurting the eye with something going into the eye. So for that, basically, just a pair of protective eyeglasses should do the job. Sometimes after cataract surgery, behind the lens there is a posterior capsule. Sometimes in some patients that posterior capsule can be opaque. If that posterior capsule gets opaque, then we can laser that capsule and make it transparent again, or open that capsule so that light can go through, recover your vision again. Routinely, secondary cataract or capsular opacification is statistically very low here at the Vision Institute. Who's a better candidate for multifocal implants? The best candidate, we need a healthy eye. That way you can have the full advantage of the multifocal lens. What exactly is a multifocal lens? A multifocal lens is a lens that gives you capability of seeing far away and near, and even now mid-distance, so that you are not dependent on any type of eyeglasses after you have this implant. And this can work not only for patients that have cataract, but patients that have that are starting to use bifocals or starting to use progressive lenses and want to get rid of those progressive lenses. Then you might be a good candidate for a multifocal lens implant. We do cataract surgery. We always need to replace that lens that we're removing, that lens that is not working properly, or that lens that is opaque. We have to replace it with a new lens. We have to replace it with a new lens because then, just like a regular camera that we remove a lens, you're not going to be able to see or focus properly. So the advantage as technology evolves, now different companies are making different type of lenses or better lenses. There are the bifocal lenses that give very good vision for far and give very good vision for near, but the middle distance, like for example a computer, can be a little bit blurry. And now the newest technology is the trifocal lens or multifocal lens, where you can see good for far, you can see very good for near vision, for reading, holding something in your hand like your cell phone, and you are able of seeing very well a desktop computer, for example. So those three distances are very well covered, and those are the trifocal lenses now that we are implanting. Cataract surgery There we have standard cataract surgery where we use blades to go inside the eye, and then us as surgeons have to do most of the work, so that we can remove the cataract. Routinely, that procedure takes about 20 minutes, to do a complete cataract surgery. With the LensX laser, we're capable of doing a procedure. The laser part only takes about 40 seconds, and to actually clean up after the laser and putting in the lens might take maybe 5 minutes at the most. So it is a very good improvement in regards to safety, in regards to accuracy, in regards to how efficient we are in doing every single step of the cataract surgery to make it perfect with the femtosecond laser.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.